Welcome everyone. Although we're a day late, we are gathered here today to recognize October 10th, World Mental Health Day, a day where the global community comes together to promote the importance of mental health education, awareness, support, and advocacy against social stigma. We have partners here today who have gathered to bring our panel of experts. We have Latanya from FCSS. We have Caston from
MHCB, Mental Health Capacity Building, Vegreville.
I'm Tammy from the Family Resource Network, and the Food Bank and Library also teamed in with us. This year's theme is Make Mental Health and Well-Being for All a Global Priority. And in doing so, in preparing for this panel, I did a little research. The World Mental Health Report came out this year after 20 years, and I pulled out 3 statements that I thought might be interesting for us to talk about in our presentation as well. First of all, mental health is not a binary state. That means we're not either mentally ill or mentally healthy, but it is intrinsic and instrumental to the lives of all people. It influences how we think and feel, and it underpins our ability to make decisions and build relationships. Mental health is also a basic human right, but like human rights, we don't often think about it until it's threatened. Mental health is fluid. Over the course of our lives, where we find ourselves on the mental health continuum will fluctuate in response to stresses in our lives. So at one time, we might feel pretty strong and healthy. It doesn't take much to undermine and shift our position on those continuums. So the purpose of this panel then, no matter where we might find ourselves on the continuum, is to break down the barriers to access information and that any individual and family might face. So our speakers today represent various community agencies who support individuals and families to access mental health services in our community. May I introduce? Yeah. We have Greg Huxley from Alberta PCN, or Alberta Health Services, sorry. I'll ask you to introduce yourselves if you don't mind. Colleen?
Oh, sorry. I'm Colleen Keeg, Addictions Counselor at Vegreville Drug Society.
Thank you.
And I'm Charlotte Thompson. I'm the Clinical Manager with Kelowna Country Primary Care Network.
And I'm Jamie Gehring with the Lakeland Center for FASD.
And Casson?
Again, I'm Cassie Konechny with MHCB Vegreville.
All right, so we've asked our experts to prepare some answers to some questions. So first of all, we are going to ask the Kelowna, right, PCN, please, to describe a little bit about what your service is. Yes, please.
Do you want me to ask?
Yeah.
So our first question is, what is your service?
So our service is community-based, and we support the family physicians in this community and 5 other communities in the area. And around mental health, we have a youth wellness clinic, and we have community support navigators, and we also use Alberta program workshops such as Happiness Basics, My Way to Health, Anxiety to Calm, Youth Anxiety to Calm. And those are the services that we provide for mental health through the PCN.
Thank you. Our second question, how do people access your service?
So there's a couple of ways you can access service, either via physician referral, or there is self-referrals also that can be completed depending on the program. So if it's for workshops, you can go to our website at kelownapcn.ca, and you'll find the events and workshop tag that will tell you which workshops are being held and when they're being held. And then there's also self-referrals through our community support navigators to different resources and programs.
Okay. Our third question, what is the cost of your service?
For the most part, there is no cost to our service. The only time that we have a cost is when we're providing the workshops, if there's printing for materials.
Okay. Fourth question, what is the wait time?
It kind of depends. So usually if you're trying to get into the youth wellness clinic, which is run by our nurse practitioner and Dr. Hollins, and so they've taken CanReach training, and so usually within a 2-week period. If the patient is urgent though, Dr. Hollins and Lynette both will try to make accommodations. For the community support navigator, usually within a week. She's only in the community once a week, but she does work Tuesday to Thursday in other communities, so she is available via email or by phone.
Okay. Our fifth question, what is the age of consent at your service?
So that one I wasn't 100% sure on, and I think it's been left up to the practitioner to decide when they're seeing a patient. There's always informed consent completed at the beginning of every intake, and I think it depends on maturity and a few other things that the practitioner sees, and then they will get hold of the parents if needed.
Okay. Question 6, do individuals need a mental health diagnosis to use your service?
No, they don't.
Question 7, will I receive a mental health diagnosis if I use your service?
Not necessarily. You can use the service without a diagnosis. You may get a diagnosis with Dr. Hollins or Lynette, but
Not with the actual, yeah, okay. Question 8, if you provide counseling, what are the different types provided?
so our behavioral health consultant does some behavioral counseling, mindfulness counseling, and some CBT.
Okay. Question 9, do you have services that help in building mental health and well-being and can help prevent challenges?
So I would say that we have the group classes that help with that, and we have the 4 of them that I mentioned earlier.
Okay, awesome. The 10th question, if I am thinking my child has a potential diagnosis, where can I go for support for both of my child and me?
I think that again is dependent on what the issue is, but if it's for youth, for ADHD, that would definitely be something that Dr. Hollins or the nurse practitioner can help with. Around the support for the adult, you could probably speak with Vanessa or the community support navigator to help you find resources, or maybe they can help you with support groups.
Depending on diagnosis, where can I go for programming to strengthen my child's ability to be successful?
I would say that's outside of our service.
Question 11, when do you refer to someone to other types of counseling outside of your service?
So when do we do it? I think, again, that's up to the discretion of the family physician or the nurse practitioner. If they've done an assessment, or if we are looking at doing the locus, so the level of where people need to be in the system, and so that might expand that. But for right now, I think it's up to the practitioners to decide.
When is a psychiatrist versus a psychologist needed, if applicable, to your service?
So I don't think those are really applicable to our service.
Not applicable. And 13, our last question for you. If a doctor prescribed me medication, what other options do I have to explore?
So I would say the group self-help classes and counseling.
Okay. Thank you very much.
Thanks.
Can I ask one question? Yeah. So you mentioned, sometimes. There you go. So you mentioned support groups. So for example, if we had a group of parents who were all struggling to get their kids diagnosed, that kind of idea, is there something that we can do in the community to create a support group? Like, can we bring experts in? Let's say we had a group of parents that were having trouble managing their children who had been diagnosed with ADHD. Like, do you facilitate any support groups?
So we don't necessarily have support groups that we just have the self-help groups that we
Okay.
do through the PCN.
Maybe I can
It's not that, like, if you had a group and you wanted the nurse practitioner to come and talk about ADHD or something like that, we could definitely arrange something like that, for sure.
Thank you, that's what I was.
Yeah.
Alrighty, my first question for you, they'll be all the same.
Okay.
Number one, what is your service?
So our service is we provide treatment to individuals in the community that have problems, concerns with mental health. We provide services to children 0 to 17, adults 18 and over. We have a seniors consultant who consult a lot with local GPs and facilities related to issues such as dementia, delirium. We have assertive outreach in our office, which deals with the more vulnerable population with more complicated mental illnesses, as well as we have a mental health liaison now who will work more closely trying to see clients in the hospital, acute care emerge for consultative reasons. We're looking towards down the road setting up a single session drop-in program where people can come in without necessarily having an appointment, just to talk to somebody for what's going on in the moment situationally. Typically what happens, it's funny because I'm going to answer some of your questions down the road here. It's just easier to explain it. The way you'd access our services, you can call the 24-hour Access and Addictions Mental Health line, and they will do the screening there. You can walk into our office in Vegreville in this case, but any office, and access services through the office by just meeting somebody who's free to be able to talk. But typically we'll ask people to call Access. We're not an urgent crisis service. So what happens is if someone calls Access, Access will do the screening, and then they'll put the client in with the appropriate therapist in the office in Vegreville, let's say. The wait time right now is about, for children and adults, is about 2 weeks to get for a new client to be seen. If a client did not meet the screening criteria, meaning they weren't really our client, Access would, meaning again, the centralized intake would give them referral contacts for other agencies in town. But that doesn't mean someone can't still come back in, because as you said, it's a fluid thing. So what doesn't seem overly urgent last week may be this week, so that people always can come in. And we're a free service. It's Alberta Health Services, so it's funded. The age of consent for us is 18. Under that, so with children, you need a parent involved, some type of guardian consent if it's not a parent. I'm just going through your questions here. Is that okay?
That's good. This is good.
Mental health diagnosis, no, you don't need a diagnosis to come and see somebody in our office. You can just come in saying, I have, I got stuff going on and I got problems. And then again, if we think don't have the time or there's a better reason, we'll refer them to that phone number and they can call. But either way, it's about, you don't need a diagnosis to come in. You just have to have things that are happening in your life that are causing you enough disruption. It's making it hard to get through your day, done what you need to get done like you normally would. Would you receive? Oh, go ahead.
So that initial meeting then, though, a screening would be done?
Yes, yes, it's always done. Yeah, yeah. Yeah, you just phone the number. They would go through a list of questions, and based on the answers, that that essentially leads them in a direction of, yeah, we're getting you an appointment, or no, you'd be better served to go maybe to this agency or that agency. So, yeah.
Would that screening process also be part of your single session drop-in? You're envisioning it? I know it's down
The
the
single
road.
session drop-in is a little bit different in that the screening is when someone's asking for services that entail, and because essentially what happens is you get screened. Then if you're a client, you're going to get an assessment appointment. That assessment that you do with the clinician in our office, the therapist, dictates what the treatment actually will be. So before that, it's just, are you a client or not? And then once you get in that assessment, then that's what drives what type of treatment. And the clinician and the client talk about what's going on, and they talk about treatment options, informed consent, all those things. So the drop-in is just literally, can I come in and see somebody? And it would have a designated day and hours and a certain time frame during that day. And
But very low barriers in terms of just.
yeah,
able to just be
realistically, no barriers to speak of. It's just come in and we'll talk and help you figure out what you need to do to get you going, or where you need to go, if that's the case. So, and it's run in a lot of other offices, so it's just something we want to start up here. So, yeah. Will I receive a mental health diagnosis? No, not necessarily. If you see a therapist, doctors are the only individuals that really can diagnose. Nurse practitioners can diagnose. We don't diagnose. We'll talk about problems, use words like depression, anxiety, but an actual diagnosis has to come from certain individuals with the right qualifications, meaning doctor, nurse practitioner, things like that. So that's kind of the answer to that question. If you provide counseling, what are the different types provided? Well, it's not a simple question because it depends on what your problem is and what you need. It could be CBT, change the way you think is a basic way of thinking of CBT, change the way you feel. But the fact of the matter is there's many strategies involved in that. For certain things it works better. Trauma-informed therapy, mindfulness. So it's hard to answer that question straight out and say what type, and then it depends on what the specialty and training of the clinician is. So, yeah. Do you have services that help in building mental health well-being and can help prevent challenges? Well, how can I answer that? The therapy itself is part of that. Just meeting with a clinician over time, you're working on garnering tools to help you cope. But therapists will help people navigate too. This, you probably might do better with this, or you might do better with that, or maybe here's the contact information for this group. Try and access that. Maybe it's Parent Link in town. We use FCSS a lot as a go-to. If we're not sure, talk to FCSS, see what's available. And with the internet now, people come in lots of times with they're already accessing something that we didn't even know about. So, does that make sense? Okay. I'm thinking my child has a potential diagnosis. Where can I go for support, both for my child and me? Well, if you come and see somebody at our office, you get screened in, now you're a client, your child, then your child's going to get seen by the therapist for whatever the problem is. But typically the parent is involved. Not always, but most of the time it depends on the age of the client. You could have a situation arise where a parent brings in a child, but the parent themselves is having issues, so they may end up seeing an adult therapist too at the same time. And then again, it's much similar to the previous question. The therapist that's seeing the child might also talk to the parent about what resources are available to help them for support as well. So, depending on the diagnosis, where can I go for programming to strengthen my child's ability to be successful? Strangely enough, the question answers the question, because you can't answer that question until you know what the diagnosis to know where to send somebody. So that one's a little bit different in that it depends. ADHD would be a different referral path than anxiety, let's say, maybe. So, when do you refer someone to other types of counseling outside your service? Again, that, you call in to do the screening. If you're not our client, they're going to refer. If somebody had issues and was at our office seeing a clinician and they also had significant marital problems, you might ask for marital count, say, you know, you should access that, those kinds of things. Grief groups in town might be an option for people sometimes. It depends what's better. It's not always what we're doing, it's what's best for the client. And that all happens in the context of talking to the client. So, yeah. When is a psychiatrist versus psychologist needed, if applicable, to your service? That really depends on the client and the clinician they're seeing. Psychologists, psychiatrists, it's about what the clinician and the client are talking about, what the clinician sees and thinks that the client might need, what the client actually is agreeable. Because some clients don't want to necessarily take medications. And if you see a psychiatrist, as I said earlier, you're going to get a diagnosis if you meet the criteria that they're trained in to diagnose. And typically, not always, but sometimes prescriptions, some people choose not to take meds. So they want the therapy. But really, that answer to that question is related to what the client and the clinician discuss and what the client's comfortable with, what the clinician recommends, those things. If a doctor prescribed me medication, what other options do I have to explore? Well, really, it's medications. Lots of people come because they don't want medications, so they prefer to try the therapy route first. Lots of times it's both. So options for people to explore. There's always therapy options in lieu of medications. Always get the most information you can. Go to the pharmacist and ask questions about the medications the doc's asking. Ask the doctor questions. Good conversation and questions will mitigate a lot of anxiety if you just ask. So, I don't know, does that make sense? Okay.
Thank you.
Oh, you're very welcome.
Okay, next up we have FASD.
Sure.
Okay, so our first question is, what is your service?
So my service is, I am an FASD outreach support worker. So my role is to build on existing supports and facilitate new supports for individuals with FASD to ensure that those supports understand the FASD diagnosis. The current areas that I serve are two Hills, Lamont, and Minburn counties. Within the agency that I work for, there are other services available like FASD training, FASD diagnostic clinics, and it's RAP 2.0 training for schools.
Second question, how do I access your service?
To access the service, you can either contact Prairie Central FASD Network or the Lakeland Center for FASD. I would be reachable by both.
Okay. Third question, what is the cost of your service?
There's no cost.
Okay. Fourth question, what is the wait time?
For my services, in particular for the outreach services, there is particularly no wait time. If I get a referral for an individual, I'm usually able to work with them right away.
Okay. Fifth question, what is the age of consent at your service?
So age of consent is 18 years old. If the individual requiring services is younger, then I would get consent from the caregiver. The only time someone who's 18 years old or older would need someone to give consent for them if there was a guardian in place.
Question 6, does one need a mental health diagnosis to use your service?
No mental health diagnosis is required, but with an FASD diagnosis, usually other diagnoses are with that as well.
Will I receive a mental health diagnosis if I use your service?
I'm not going to say it's for sure, but it's a possibility if you're going through the diagnostic process.
Number 8, if you provide counseling, what are the different types provided?
I do not provide counseling, but I would be able to assist in finding those supports.
Awesome. Number 9, do you have services that help in building mental health and well-being and can help to prevent challenges?
Having an individual connected to our services does foster mental health well-being. And again, in my role, I would I would seek out other community supports to help with the mental health well-being piece as well.
10th question, if I am thinking my child has a potential diagnosis, where can I go for support for both my child and me?
So if a caregiver or parent feels like their child requires an FASD diagnosis, I'm there to support the caregiver or parent with strategies on how to help the child that's being diagnosed. I don't work directly with the child, but I will work with everyone who's involved in that child's life, like school, daycare, after school care, or any other supports involved.
Depending on diagnosis, where can I go for programming to strengthen my child's ability to be successful?
It all depends on the recommendations if your child does receive an FASD diagnosis. So we would connect with the school for sure, and then look at the child's ability to be successful, look at things like OT, SLP, counseling, extracurricular activities, and again, we would just use our community connections.
When do you refer someone to other types of counseling outside of your service?
Like I said earlier, I don't provide counseling for individuals. I assist. So what I would connect individuals and families to appropriate supports to ensure they are FASD friendly.
When is a psychiatrist versus a psychologist needed, if applicable, to your service?
That one's not really applicable to our service.
And our last question, if a doctor prescribed me medication, what other options do I have to explore?
That would be a conversation that I would suggest that the individual has with the prescribing doctor. If there are other available options, and then I would just assist that individual in looking at those other options.
Thank you.
Thank you.
Colleen?
Okay. Our first question for you is, what is your service?
So our service is an outpatient one-to-one counseling for substance use issues and concurrent disorders. We do addiction prevention and mental health promotion.
How does one access your service?
You can phone the office at 780-632-6617, or you can drop in and make an appointment as well.
What is the cost of your service?
There is no cost.
What is the wait time?
The wait time, we can say 1 or 2 days. If you come in at the end of the week, of course, we'd see them the next week, but there's also could be an opportunity when they drop in that we could see them that day. It depends on how busy the counselor is. So,
What is the age of consent at your service?
18 years.
Do I need a mental health diagnosis to use your service?
No.
Will I receive a mental health diagnosis if I use your service?
No.
Okay. If you provide counseling, what are the different types provided?
We provide addictions counseling for substance use issues, also mental health issues related to addictions, and for also those impacted by someone else's substance use. Our philosophies basically are we meet a client where they are, so that could mean harm reduction or it could mean abstinence, depending on client needs.
Do you have services that help in building mental health and well-being and can help to prevent challenges?
Yes, we do things like relapse prevention plans and other things that were previously mentioned, and we do work through counseling, we work through a variety of challenges.
So through the counseling, you will make sort of plans, individual plans with the client?
Yes, it's all client-based and needs-based, yep.
I'm not sure if this one would apply, but if I'm thinking my child has a potential diagnosis, where can I go for support for both my child and me?
Not really applicable. However, if there is like a parent teenager and, you know, the parent is worried about the teenager possibly having an addiction, then we can actually talk to them both separately or together, whichever they want.
Depending on diagnosis, where can I go for programming to strengthen my child's ability to be successful?
Not really applicable to us.
When do you refer someone to other types of counseling outside of your service?
It's always based on the needs of the client. So depending on what comes up in counseling, what their needs are, we would refer accordingly.
When is a psychiatrist versus a psychologist needed, if applicable, to your service?
Not applicable to our service.
Okay, and our last question, if a doctor prescribed me to medication, what other options do I have to explore?
Again, not applicable to our service.
Okay, thank you.
Thanks, Colleen. Latanya, you're up.
You review the questions? Okay. Okay, our first question, what is your service?
So I'll start by saying my name's Latanya and I'm the community programmer for FCSS, and I'm speaking on behalf of our community counseling program that is contracted through Guided Path. And so through Guided Path, they offer individual sessions, so therapists will work with you using a variety of counseling modalities to help address the issue, concerns that you wish to share using a strength-based approach. They also offer couple sessions, so counseling and therapy in a safe space to have open and respectful conversation with discussion will provide tools to strengthen emotional and communication, as well as there is family therapy, parenting, and co-parenting, so providing a supportive place to discuss issues and solutions to better strengthen relationships and build upon existing strengths as a family.
Second question, how do I access your service?
So to access the Guided Path Counseling, you can go onto the Town of Vegreville website, and under Live is the FCSS page, and there's the community counseling poster. So you can access it also through their website at www.guidedpathcg.ca. You can call 780-318-1480 or 587-907-5013, or you can email them at admin@guidedpathcg.ca.
Okay. Our third question, what is the cost of your service?
So with the counseling service, there is low cost, or in some cases, no cost appointments. It's based on a sliding scale.
Okay. What is the wait time?
So it really depends on what kind of service you're wanting, as we do offer in-person, virtual, or phone. And so when you go onto the website to book or call, it depends on the counseling availability, but it's not very long usually.
What is the age of consent at your service?
So Guided Path age of consent is at 14.
Do I need a mental health diagnosis to use your service?
No.
Will I receive a mental health diagnosis if I use your service?
So it really depends on what an individual is looking for. The Guided Path team can diagnose, but not every one of their team members can. Upon intake is where you're referred to the best team member that aligns with your goals and needs. So through that discussion and intake process, they align you with the counselor that best serves you.
If you provide counseling, what are the different types provided?
So there's quite a bit that Guided Path offers. And so we're going to say some technical terms, and then we'll really get into some of their specialization. So they offer eye movement desensitization and reprocessing, cognitive behavioral therapy, acceptance and commitment therapy, solution-focused therapy, motivational interviewing counseling, relation-based therapy, certified emotional focus therapy, internal family systems, and narrative therapy. But their specialized areas include ADHD, anxiety, bipolar, children, youth, adults, and seniors, couples, parenting, co-parenting, depression, grief, loss, and trauma, learning disabilities, LGBTQ2S+ life coaching and life skills, illness and injury, postpartum loss or depression, PTSD, and sexual difficulties.
All of these are the areas that are available
Yes. Yes, through Guided Path, you can access all of these through the town of, like, through the Vegreville contract here. So they offer these throughout their whole entire company.
Do you have services that help in building mental health well-being and can help to prevent challenges?
So as we've said multiple times today, mental health is on a fluid. So Guided Path really prides themselves on focusing on interpersonal growth and change, so strengthening the individual where they're at.
If I'm thinking my child has a potential diagnosis, where can I go for support for both my child and me?
So through discussion and supporting the clients, Guided Path can support both the parent and the child, as they do offer for different age groups.
Depending on diagnosis, where can I go for programming to strengthen my child's ability to be successful?
So Guided Path would refer to programs such as we have here in Vegreville through the FCSS, FRN, MHCB, all of these child programs as well as adult programs, because they really focus on strengthening the child where they're at. And just because they have a diagnosis does not mean that they can't participate in some of the programs that are offered here in Vegreville.
When do you refer someone to other types of counseling outside of your service?
So they refer outside for more complex needs, such as bipolar when it's on an extreme level or outside of their realm, or as well as everything out of that skill set that we mentioned. And I also want to double back actually on the other question that was mentioned about where they can go to strengthen supports for direct programming supports. They also refer people to check out the Institute for Child of Psychology. That's a really great website that they offer, as well as the CRTI, so Crisis Trauma Resource Institute. So through there you can take online webinars, classes, programs, as well as they do bring in guest speakers to Edmonton as well.
And number 13, I believe, the last question. Or did I miss
12, when is psychiatrist versus a psychologist needed if applicable to your service? So a psychiatrist is only needed if taking medication. The psychiatrist provides the prescription and it is encouraged to use with the mental health diagnosis if needed, but only if needed, where the psychologist and social worker can do the counseling to support the medication. So you don't just get the medication, you get the counseling and supports to go along with it, so it's a dual service.
And number 13, if a doctor prescribed me medication, what other options do I have to explore?
So, like said, if there is medication, there's always the skill development that goes along with it, as one only gets so far, right? It's more of a tool, the medication, where you need the other tool to help support that. And as well, they work with individuals if wanting to grow and not be on medication for the rest of life, they help them create a plan to help strengthen them for that.
Okay, thank you.
Awesome. Thanks, guys.
Okay.
Okay, so before we wrap up, I just want to let you know what MHCB does. We are not counselors, but we do work in mental health. So
Austin, can you say what MHCB stands for?
MHCB, okay, so MHCB stands for Mental Health Capacity Building, which means that we really work on building skills to deal with mental health at the youth age that apply for the rest of our kids' lives. So what is our service? Again, we teach mental health preventative and literacy building programming in all of the Vegreville schools. Our focus is on universal programming as well as targeted that really work to help build mental health strategies in kids. How does one access our service? So our service is for school-aged kids, so typically kindergarten to grade 12. Any Vegreville youth that go to our schools. And if you need more information on the types of programs that we teach in our classrooms, all of that information is on our website, which is mhcbvegreville.com. And you will also be able to find my contact information as well as my two colleagues' information on our website as well. But that is kind of our area that you can go to see kind of our mandate and all the different types of programs that we teach. And number 9 is applicable to us. So, do you have services that help in building mental health, well-being, and prevent challenges? So, yes, this is our goal. This is our job, to build that prevention and coping strategies for youth throughout our universal and targeted programs. And I also just wanted to mention number 11. So, when do you refer someone to other types of counseling outside of our service? So, we are not counselors, but there are school counselors within all of our schools. So, if a child would come up to any of us with something that we felt needed to be referred to a counselor, we would refer that to whoever the school counselor is at the school that your child goes to. But we are not the counselors. We just teach the preventative programming. But your child will be referred to if somehow it gets to us in some way. That's everything. Thank you.
Thank you, and thank you to all of you for being here and answering our questions today. As I said, this was a way to present a bunch of information from different sources quickly and easily, hopefully. And no matter, this day is really about taking time to think about mental health, and that it is a much bigger concept than just absence of illness, right? Thank you all.
Thank you.
I don't know, Lieutenant, how else to end it?